Waiting for your COVID-19 test result can be worrisome. Living the next couple of days anxiously waiting to find out if you have the virus or not. So what exactly happens to your sample after you have been tested? ABC4's Brittany Johnson got an exclusive look inside of one of Utah's public health labs and shows us the process that determines if you have coronavirus or not.
Pop-up testing sites. It's the new normal across the U.S. and here in Utah. But what happens after your test is bagged up and you drive off? The state health department gave ABC4 News unprecedented access to arguably the most important room in Utah right now. After your swab for COVID-19, your test sample comes to this room. ALESSANDRO ROSSI is the chief scientist in infectious diseases at Utah Public Health Laboratory.
We managed to test most of the specimen within 48 hours from receipt.
Upon arrival, the patient's information is entered in a tracking system. Every specimen is then numbered with a barcode and taken up to a laboratory for testing.
The first thing is to break the virus and extract that RNA, and that is done with some instrumentation. One example is this one.
You ready for this?
He's now mixing the RNA with the ingredients of the reaction.
Once the virus's genetic material is extracted, the specimen is taken to a different room for preparation.
You don't want contaminations, so it needs to be prepared separately from the extraction room.
The final step is testing. How many of these machines do you guys have?
So we have 4 here in this room, and then we have another one in our BSL-3 lab.
93 samples can be tested at once. And overall, the state of Utah has the ability to perform 5,000 to 6,000 tests per day.
The public health laboratory is about 15% of that.
Robin Atkinson-Dunn is the director of the Public Health Lab and helps coordinate all the testing statewide. Dealing with an unprecedented and historic pandemic was daunting.
I never experienced anything like this before.
Early on in the crisis, there was mounting concern over a shortage of swabs.
Supplies were almost non-existent, from the collection materials, the swabs, and the material, the medium that the swabs need to go into were almost non-existent. And then the test kits were also a problem as well.
But now, Atkinson-Dunn says labs are all up to speed.
Over 300,000 swabs available in the state, which is much better off than we were before.
FEMA, along with Health and Human Services, is also working diligently to ensure states have the needed testing supplies.
That over the course of May and June, we will likely be getting close to 300,000 swabs from those areas.
Slowing the spread of COVID-19 is the lab's top priority, especially in communities hit hard by the deadly virus, and supplying tests for disadvantaged populations.
For example, Public Health Lab has provided testing for the Navajo Nation.
These scientists not only test for the virus, they help track it down.
You may have heard that in Utah, most of the cases are in long-term care facilities. So we assist in those investigations.
Our goal is to really protect the public and to make sure that the answers that we're giving influence public policy and do it in a way that makes sense and is reliable.
When it comes to the fight against COVID-19, scientists working behind the scenes are often overlooked. But without these unsung heroes, none of the pieces that go into fighting a pandemic would fit together.
This would not happen without the hardworking people, especially here at the Public Health Lab, Alessandro and his team. It just really wouldn't happen without them.
Reporting in Taylorsville, I'm Brittany Johnson, ABC4 News. Inside the Public Health Lab is cutting-edge technology helping lead the way in the fight against COVID-19. It's called next-generation sequencing. A big portion of it is done in this machine. Utah was the first state to figure out how to apply the technique to COVID-19 testing. Using this instrument, scientists can see how the virus mutates over time, which geographical location it came from, and which other Utahns are infected with similar strands. This kind of information can help determine if social distancing is working, mitigate outbreak detection, and lead to a vaccine for the virus.
If we know who you've been in contact with, where the virus is spreading to, we can intervene at a public health level and stop that spread.
Coming up Tuesday night at 10, we go one-on-one with Kelly Okeson. We'll have more on how this technology is being used by researchers nationwide and internationally, and what it means for the future of this pandemic. Back to you in the studio.